Today, as we proceed to launch our framework to partners, I'm especially delighted to welcome Patricia Faulkner AO, former chair of the Australian Social Inclusion Board, the entity which originally defined the domains of social inclusion that the UNRES have adopted. And we invite her to share with us her role and that of the Social Inclusion Board, and as is so fitting at the end of the forum, to formally launch the Social Inclusion Framework. It's my great privilege now to share a brief snapshot of Patricia's distinguished career dedicated to advancing inclusiveness. Patricia is a chairman and board director with extensive senior and chief executive experience across a range of sectors, including health, welfare, banking, telecommunications, government, superannuation, and professional services. Patricia currently chairs the boards of Jesuit Social Services, the Telecommunications Industry Ombudsman, the CBA's CEO Advisory Panel, and the Melbourne Racing Club Foundation, and is a board member of several others. In 2015 and 16, she served as a Deputy Commissioner to the Victorian Royal Commission into Family Violence. Patricia was a previous Secretary of the Victorian Government's Department of Human Services and held a number of roles within the Victorian Government, including Director of Consumer Affairs and Director of Occupational Health and Safety. Patricia's full bio has numerous previous positions of note and, as mentioned, Chair of the Australian Social Inclusion Board. Patricia was made an Officer of the Order of Australia in 2008 for service to the community through the development and implementation of public policy related to health, aged care, children's services, disability services and housing. And in 2013, Patricia was recognised with an honorary doctorate from Monash University. Welcome, Patricia.
Thank you very much. And thank you, Tracy, for that extremely generous outline of my career. Thank you. I'd like also to join in your acknowledgement of the traditional owners of the lands on which we're meeting today and pay my respects to their elders past and present and to their emerging leaders. It was certainly a delightful surprise to be approached by Sue recently, a couple of months ago actually, to ask if I would like to participate in the launching of the social inclusion framework that's been developed by the Inner East Primary Care Partnership for use within the health promotion context. In 2008, I was invited by the then Deputy Prime Minister, Julie Gillard, to chair the inaugural Australian Social Inclusion Board. With me on that board were some very eminent and famous Australians. They included Fiona Stanley, who was the Australian of the Year in 2003 and was recognised for her work in epidemiology relating to children's health. There was also another famous person, or someone who became more famous afterwards, Ahmed Fahua, who became famous for being the highest paid Chief Executive Australia post. However, at that stage, his interest was from his position at the National Australia Bank in micro business financing. Eddie Maguire was there, as was Tony Vinson, who had just published his book, with Jesuit Social Services' help, on the distribution of social disadvantage in Australia. There were some leading welfare luminaries, such as Tony Nicholson from the Brotherhood of St. Lawrence, Dr. Chris Sara, a renowned Indigenous educator, and Dr. John Falzon from the Society of St. Vincent de Paul. In my life, from the years 2008 to 2012, social inclusion and what it was and how to achieve it and how to measure it were a central part of my working life. with the board and with a very small unit in the Prime Minister's Department in Canberra, we set out to define what being socially included meant and to work out how governments and communities and professionals could counter the very grave effects of exclusion. We wanted to work out how to measure the progress of Australia to a society which included all people. So on a sunny day in 2008, the 13 new members of the Australian Social Inclusion Board joined the newly minted Prime Minister of Australia, Kevin Rudd, and the Deputy Prime Minister, Julia Gillard, who was also the Minister for Social Inclusion at the time, at the Broadmeadows Library, Broadmeadows in Victoria, obviously, to launch its work. When we arrived, we were very delighted at the interest that people had in this launch, and we felt very positive about the fact that the press had that interest. We were soon to discover, however, that their interest was purely in Eddie Maguire, the most famous son of Broadmeadows, and he managed to overshadow both Kevin Rudd and Julia Gillard. And that was probably because the concept of social inclusion was very, very difficult for people to understand. There were so many ways in which people could be socially excluded, through lack of education, through homelessness, poverty, illness, and simply by the place in which you resided. There was also great confusion between how did loneliness compare with exclusion. So we started a search for a simple but comprehensive definition and explanation of what is social inclusion. At the same time, we also saw the emergence of literature relating to the social determinants of health. I had worked, as was pointed out, for the years 2000 to 2007 as the Secretary of the Department of Human Services in Victoria. And at that time, the department had oversight, funding responsibilities, or direct service delivery responsibilities for the Victorian public hospital system, for the community health system, for child protection, juvenile justice, disability services, housing, and homelessness services. And we knew through our work that a person's welfare status was in fact determined by an extremely complex set of factors, including place. The catch cries at that time in our department were about joining up services and the importance of the development of social capital. However, the notion that health outcomes were determined by social factors rather than curative treatments was only slowly emerging. Luckily, most people who came onto the board understood that excluded people's lives were extremely complex. And yet, the treatment systems and the support systems broke people's lives up into pieces and treated people's problems in pieces. Certainly, the Department of Human Services at the time initiated a number of neighbourhood renewal projects, which were recognised as successful when they were finally evaluated, but nevertheless, they disappeared from sight soon after. The treatment systems, as I said, broke people's lives up into pieces. So some families could be being served by up to 6 workers. They might have a drug worker, they might have a homelessness worker, they might have a child protection worker, they might have a family violence worker who was separate. And so we tried very hard to simplify the concept of social inclusion. We came up with a description that's already been mentioned that has found its way into the social inclusion framework that is being launched here today. I'll go back over the definition because it took many hours of work to come up with it and lots of debate. Essentially, we started from what people wanted to be included. They wanted a job or an activity or an occupation. They wanted to be educated. They wanted to be engaged with people around them, and they clearly wanted to have a voice. So we came up with learn, work, engage, and have a voice. And we expanded on some of that by saying, well, learning was pretty obvious. You get to participate in education and training, and that might be lifelong education rather than necessarily an episodic view of education. Work was one that was debated a lot. At the time, the prevailing view that work was, and the only sort of work that was valuable, or it seemed to be a prevailing view, was paid employment. But we clearly felt that unpaid employment, voluntary work, and caring responsibilities were part of work. Engaging was connecting with people, using local services, and participating in local cultural and civic and recreational activities. And the focus there was on local, because the work on the importance of place in social inclusion was emerging quite rapidly. And having a voice, I think, has never gone away, but it is often something that is totally ignored. Having these definitions gave us some goals to aim towards. However, we also knew, and it was emphasised greatly to us, that what gets measured gets done. So we embarked on trying to bring together a set of indicators which measured social inclusion. We believed that public focus on published indicators might prompt community interest in social inclusion. Although it was an interesting exercise, it probably, with hindsight, may not have been the best use of our time. Measuring exclusion was extraordinarily complex for the very reasons I described earlier, because we actually had indicators that measured our practice as it was then. So we had measures of parts of people's lives. We'd always aspired to eventually coming up with a clear index of well-being, but to this date, we've not achieved that. We did have measures of parts of people's lives, as I said. We did have measures of poverty, illness, disadvantage, and we published, I think, 2 volumes of those indicators, trying to get people's focus on what inclusion could do to make our society a better place. However, with hindsight and knowing that we didn't survive long enough to do this, I wish we'd put more emphasis on changing practice of how we dealt with exclusion. We needed to recognise, and I think this framework recognises, that we need to understand people in their context and in their system. Certainly, Tony Vinson's work in Dropping Off the Edge showed that many different kinds of disadvantage, such as poorer housing, lower educational attainment, poorer social connectedness, community capacity, unemployment, and crime rates, tended to coincide for families and individuals in a relatively small number of places. And these concentrations of disadvantage tended to persist over time. So we at Jesuit Social Services have continued to work on Tony Vinson's work. He's unfortunately passed a number of years ago. And we continue to see that those concentrations of disadvantage, sometimes called postcodes of disadvantage, persist. So we therefore have to look at the system's factors to see what is going on and to find solutions. At the time, we also did some work on intergenerational disadvantage, which involved us in meeting with families and people who appeared to us to be socially excluded. They had been parts of families that had been generationally unemployed and in public housing. they actually taught us a great lesson. And that lesson was to listen very well to what people's perspectives were, rather than impose our solutions or aspirations on those people. By doing that, of course, you rob people of agency. They rejected the notion that they were disadvantaged, and they felt sorry for us because they believed they had a level of connectedness that made them happy. As I said, had the Social Inclusion Board's work been given a longer life, we might have got to the point of looking at practice innovations. But what I can say to you is the Australian Social Inclusion Board would have applauded the approaches outlined in the framework that you have before them today. They would have delighted in the case studies to be presented soon. And from my own perspective, a great influencer in my career was a man called David Green, who probably is not known to many of you, but he would see that in the Inner East Primary Care Partnership, we see a rising to the notion that if we are to help people with complex lives, we should have a workforce that can deal with complexity, that can understand the determinants of exclusion, and can work at many levels. Yes, with individuals, yes, with groups, with families, maybe better in a community, and certainly at a system level. It is often the understanding of the system which brings solutions. I want to close in thanking the organisers of today's event for including me in it, and express once again my gratitude that the work of the Social Inclusion Board is finding life so much after its demise.